Hey everybody, my name is Eric Norman, and welcome to the Flex Metal podcast. I'm a physical therapist, and shortly I'll be joined by my colleague Christian Jorns, who is also a physical therapist. Today we're going to be talking about the Hamstring clinical practice guideline, and we're going to break it down and hopefully make it a little bit more digestible for you all about rehabbing things such as hamstring strains, or you might know it as like a pulled hamstring, and discussing kind of what the research tells us is the best way to do it. So hopefully you enjoy the podcast. Thanks so much for listening. And as always, reach out if you have any interests or thoughts on a different topic for a podcast, or if you have any questions or want to get started on a program with us, reach out, let us know. Anyways, thanks so much for listening. Have a good day. Earlier in the intro, that's what we're going to be talking about today, is the hamstring, and talking about the hamstring CPG. Again, the CPG is just the clinical practice guideline that we use to make decisions around certain diagnosis. Hamstring strains, like I said, is the topic today. And so I think it's good just to discuss first, what are the hamstrings? Where are they? What do they do? And then also, what is a strain? So if you don't mind, Christian, I'll just go over quick kind of what the hamstrings are. So the hamstrings are on the back part of your thigh. We call that posterior, or the back part. They connect either on the upper thigh bone, that femur, or even up on the hip, called our ischial tuberosities. And they stretch all the way down to the back of the knee. Some of them connect before, like at the top of the knee joint, and some of them connect down below that knee joint. And what they do are the main thing is they flex the knee. So when you do things like on a seated knee flexion machine where you bend the knees down against weight, those are called hamstring curls, right? But what they also do is they also can help extend the hip. And so we do hip extension. And so if you kind of hook your ankle up to a cable column and then you kick the leg straight back while keeping the knee straight, that's also another way you're going to get activation of the hamstrings. Again, back part of the thigh, and they're going to be bending the knee. That's kind of their primary focus. But secondary, some of them also cross the hip joint, so they're going to extend the hip. And then we actually have kind of three different muscles, if we want to think about it, that make it up. One of the muscles is called the biceps femoris, and biceps, so it has two heads. That lies on the outer part of the back thigh, and then the medial part of the thigh, or the inner part, has kind of what's called like the semis, so the semitendinosus and the semimembranosus. So that's a quick rundown of what are the hamstrings, what do they do, where are they located, what are the actions, etc. And then if you'd like, Christian, if you want to discuss quick what a strain is.
A strain is where some kind of mechanical overload, so you're doing too much than your body can handle, and the fibers of your muscle or your tendon or your fascia and even your blood vessels within that whole system, they get damaged, they get overworked, they get some small tearing, and that's what a strain is. Now we have three different grades of strains. Grades 1, 2, and 3, mild, moderate, and severe. And they're based on several factors, but the biggest one's going to be they're based on like the extent of the damage of the area. And I think of it kind of like trying to snap a stick. If you start bending a stick in half and you get a little bit of creaking, that's probably your grade 1. If you keep bending that stick and you get like half of the stick to break a little bit, that's your grade 2. If you snap the thing in half or like fold it over itself, that's your grade 3. And you can probably guess that grade 3 and 2 take a lot longer than grade 1 to heal. So thinking about timing of healing, these are all super rough numbers, but grade 1 strains, you can expect to be pretty recovered in the first 2 to 4 weeks. Grade 2, that's like 1 to 3 months. Grade 3, that's about 3 to 6 months. But I read in the CPG that it may take, for those bigger strains, it may take even up to 2 years for you to have complete remodeling of that torn hamstring. And that just is because your body does take a super long time to finish out that last bit of your healing process. But especially if it's more of the fascia or the tendon, which has less blood flow, things just take a lot longer. And not just blood flow, but like the tissue itself doesn't heal nearly as quickly as muscles do because of just the way it's made.
And I also, if it's a higher grade strain too, I also think it's dependent on what the individual does for either like sport or activity as well. And so, if you're putting crazy high demands on that hamstring in some form of sport that involves a lot of sprinting or powerful movements or jumping, and then we're gonna be erring on the side of probably longer time because it's gonna take, we're gonna have to try and build that up more in order to handle all those extra loads versus like if you were to strain your hamstring, playing pickup basketball and then you're like, look, I don't need to play pickup basketball anymore or whatever it is. And then maybe for you might not take as long because maybe you might not have goals of getting back to playing a, collegiate level sport or something, right? So also kind of context in terms of what people are doing as well, which I think brings it in nicely into kind of the diagnosis and the risk factors that are out there for the hamstring strain. One thing that I thought was really interesting, and there's one of the things we learned right away in PT school about risk factors. This goes for any injury, right? So we have modifiable and non-modifiable things we can change and can't change. Non-modifiable, two of the things that they listed were, one of them was age, right? But then the other one was also previous injuries. And so people who have previous hamstring injuries, 2 to 6 times higher of getting consecutive hamstring injuries. And that kind of goes with anything in the body though. Like if you hurt your rotator cuff or, if you hurt your low back, it's like you're automatically at a higher risk of having recurring injury or pain in that area just because of the previous injury. And then some of the other things like the modifiable stuff, I thought this was really interesting. Like BMI didn't seem to play a huge factor in terms of being a risk factor of hamstring strain. So if you have a high BMI, research shows it's not really that much of a risk factor. Flexibility. Flexibility didn't seem to have a big influence in terms of risk factors for hamstring strain. Weakness did have some limited evidence it showed. And then sports that require high speed or high demand on that hamstring, those show to have, risk factors. So I don't know, Christian, what are your thoughts on that? I thought that those modifiable risk factors like flexibility and BMI that didn't show to have extremely high risk, I thought that was really interesting.
Yeah, first thought is I think you're reading off of my notes. You stole all of my thoughts. But the BMI one makes sense. Like your body weight isn't a super strong predictor of injury. For some, it is like arthritis type pain. It certainly can make those things feel worse. But the stretching one, that's something that we just see all across the body is like your flexibility doesn't seem super linked to your risk of injury. And a lot of that comes with how do we define it? Like how are you exactly measuring what normal flexibility is? But also like who cares if you measure it great? Does it actually matter a whole lot? What are the outcomes? Like it's fine if you want to collect a bunch of information and try to make decisions off of it, but at the end of the day, you have to ask yourself like what things that I'm measuring actually lead to outcomes.
Yeah.
Stretching's just not it. The muscle performance piece, that one took me by surprise, actually. I figured that they would have said that there was some kind of link between weakness and strain, since like it sort of makes intuitive sense for people where like, okay, if the best treatment for a muscle strain is going to be strengthening it, why wouldn't being stronger ahead of time reduce my risk of injury? And I think that's kind of like what I said about the flexibility thing, where we just don't know how strong you need to be for anything really. Like there's no like number of pounds you should be able to pick up from the floor or squat with to reduce whatever risk of injury or increase your life, whatever it is. We just don't have those measures. We don't have strength standards. And so because of all that, I think it's probably just very difficult for researchers to say definitively that this certain level of weakness is actually a risk of injury.
It's not like, it's like, oh, you can do 5 or 10 consecutive Nordic hamstring curls. All right, you're good. You're not going to get a hamstring strain. But like, there's nothing we just don't have that. Because, like to your point, the other thing too, I want to just bring this up. I didn't see it in the CPG. Maybe I missed it, so I want to ask for your thoughts. And if not, this could just be a good riff we can go off of for a quick sidebar. There's countless times that I see individuals that will get hamstring strains, and then other individuals will say it's because your quads aren't firing, or your quads are, you know, over dominant, or it's always something to do with the quads, right? What are your thoughts on that? And do you think the quads are to blame at all when it comes to hamstring strains?
They actually did talk about this in the CPG,
Okay.
and yeah, they said there are conflicting results from the research when examining hamstring to quadriceps strength imbalances as a risk factor for hamstring strain injuries. And that's very common among different parts of your body. Like we don't have clear evidence that you need to be at a certain ratio of quad to hamstring strength or a certain like actual raw strength number in your quads versus your hamstrings. Like that stuff is just, it's not super consistent. And we used to think it was. We used to think that ratio was really important because there was some earlier research supporting that. But over time, we've changed our minds. It's not super clear. I will say
Hmm.
that it is decently important, at least it seems, at least to me, in ACL tears. Like you do want to have a certain rough ratio of your quads to hamstrings, or having like ridiculously strong quads compared to hamstrings seems to be a risk factor for re-injury in that population. But for this, I don't see how it matters.
I I love what you said there about just, yeah, it does conflicting evidence. Doesn't seem that there's enough to really show or produce any concrete answer towards that. And I would agree with you on that, on the ACL stuff. I think there seems to be, at least for me, enough to say that quad to hamstring ratio when it comes to ACL, and especially like after ACL, and when you're doing rehab, wanting to get those quads to a certain point. But anyways, keeping with the hamstring CPG going on, when they talk about their diagnosis, I liked how they laid it out there. They basically said for diagnosing a hamstring strain, sudden onset of pain in the back of the thigh with an activity, or during an activity, and it is reproduced with strength or flexibility testing. So basically, if you stretch out that hamstring and it hurts, or if you try and strength test it and it hurts, to me, it kind of was like, if it looks like a hamstring strain, if it feels like a hamstring strain, if it smells like a hamstring strain, it's probably a hamstring strain. So that's kind of how the CPG lays out the diagnosis for this, which I thought was pretty funny, but also just like, oh yeah, that seems really straightforward.
Yeah, and that just makes complete sense, right? Like that's just like you said, if it walks like a duck, quacks like a duck, whatever, that's what it is. I did like how they outlined some other criteria for deciding on what grade of injury you have, like grade 1, 2, or 3. So like for grade 1, they said you're going to have very local pain in a smaller area. You'll have some tightness or possible cramping in the thigh, that kind of stuff. So very mild symptoms. And then you contrast that with grade 3, which is a severe strain. They say like you'll have diffuse swelling and bleeding. Like your whole thigh is going to be purple. We've probably all seen that. You might
Yeah.
have like a lump in the back of your thigh where like you're like, okay, that's probably where the muscle's really torn. So just adding a little bit of extra layers to us being able to differentiate the degree of the tear is always helpful for the patient to
Hmm.
understand how things are playing out, but also us when making that diagnosis.
Yep.
Did you
Yeah.
see the imaging piece about that?
I saw that it was like hamstring strains oftentimes do not require imaging.
Yeah, that's what it was. Yeah, so for grade 1 and 2, we really don't need any imaging to help you get better. It's like getting an image to determine the exact extent of your muscle fiber tearing or whatever doesn't help you get better faster. It's not like we choose different exercises based on the degree of that tearing in grade 1 or 2. And even in grade 3, I've had people who are just like, yep, this thing's pretty bad, but we know what it is. We know what to do to get it better. You don't want to have surgery, or you don't qualify for surgery. Let's just get going. Why spend the time and the money going to more doctors for more testing like an MRI? And the authors were very clear in the CPG that for grade 1 and 2, don't bother imaging. Grade 3, maybe depending on the severity.
Yep. Yeah, no, I was gonna say, yeah, I saw that same thing, um and yeah, I mean I totally agree with that. I think in this is a little side rant again, but in America, we like to spend a lot of healthcare dollars and we like to do things like imaging as much as we can for a lot of different things. And it's pretty clear that in this case, this scenario, we don't need to be imaging it really a whole lot. And so, like you said, it doesn't really change our input of the exercises or course of treatment we're going to do. I would say, if anything, if someone came to me with a grade 2 hamstring strain versus a grade 1, to me, that just shows that their irritability level is probably just much higher in that grade 2 than the grade 1. And so we're going to probably do similar stuff, just not as intense.
That's really it.
Yeah. Sorry for people that were coming on here hoping to get a magic bullet for a hamstring strain rehab. We're just keeping it short and sweet today. But anyway, so then I think moving on, let's talk about kind of like interventions, or what your thoughts were on, different interventions that they talked about in the article. One of the things that I liked was that they discussed right away, they talked about eccentric strengthening. I thought that was like, okay, yeah, that makes sense, eccentric strengthening. And then one thing that I thought was interesting, the expert opinion, they talked about neural tissue mobilization to reduce adhesions of surrounding tissue. What were your thoughts on that for an intervention for a hamstring strain?
That's one that I just don't know. Like, there may be some evidence out there that says if you do stretching or neuromobilization that you're going to decrease the risk of scar tissue formation. I just don't know that. So I'm not going to say like that's right or wrong or anything like that. But it seems like based on these experts that that's something that they recommend. Do they recommend it because it truly does break up adhesions? I don't know. But does it make the people feel better? Yeah, probably. Like for example, for anyone that has a mild muscle strain or tendon pain, I will often prescribe some level of stretching or neuromobilization if it feels good. I know we're not like stretching the crap out of it and like running the risk of tearing that area further. If they're going super gentle and it feels good, great. Sometimes stretching it though makes you feel a lot worse. So then in that case, I wouldn't do it.
And I guess for people that aren't familiar with the term neural mobilization, think about your nerves coming off that spine, right? Going down into the leg, into the arms. The nerves kind of travel through muscles and tendons, kind of like a tunneling system. And so the theory behind it is that, well, if that tunneling system around the nerve is strained and gets tight, and here they discuss like things like adhesions, then that can restrict that nerve mobility, because the nerves kind of slide around or inside of the muscles and the tendons in the tunneling system. And neuromobilization, it sounds kind of fancy, but like you said, Christian, it's just kind of like stretching. Like when you look at a position of like sciatic nerve mobilization, and then you look at a hamstring stretch, it's like, those two look pretty interchangeable. So it's basically just stretching, but that's the idea behind what neuromobilization is and kind of why it would help prevent certain things.
Right. Yeah. So that one, didn't expect to see that one, but sure, makes some sense. The biggest one though that we probably should spend some time on is going to be eccentric training or just general strength training. So the most important thing that we have to make sure that we're doing after someone strains their hamstring is making it stronger again, because it got damaged from that mechanical overload. It makes sense that we should be rebuilding that thing, hopefully better than where it was before. And when it comes to figuring out what's the most effective way to get someone better the fastest, while also making sure that you reduce their risk of re-injury the best you can over time, we've really figured out that training the hamstrings eccentrically yields the best results. I'm not saying like only eccentrically, but you definitely should have a major component of your rehab plan have eccentric strength training. So for example, that's like a Romanian deadlift where you're bending forward at the waist with dumbbells or a barbell, but that bending forward movement is very slow. You're fighting that weight pulling you down for, I would say 2 to 5 seconds is probably a really good range. You really feel that tension build up in the back of your hamstrings, and then you come right back up. So just doing that, and other than like trying to get an eccentric contraction, the other most important thing is going to be making the weights heavier over time. When it comes to building strength, you don't want to go like, let's say you're doing Romanian deadlifts with 100 pounds and you start at 5 reps. You don't want to over time just keep increasing your reps more and more and more to like 15, 20 reps. That's not as helpful as if you were to just like train. I think the authors even said in the CPG, like in the 6 to 12 rep range, making it pretty heavy. You know, they didn't say this in the CPG, but a good difficulty level to think about for how to train your hamstrings eccentrically would be like a 7 to 8 out of 10 rating of perceived exertion, or like a 2 to 3 reps in reserve as like the long-term goal. Early on when you're recovering, that might be hard to do just because it hurts too much. But over time, that's really where you want to land, is training those hamstrings with relatively fewer reps, relatively higher weights, good challenge through lots of range of motion with an emphasis on that eccentric contraction.
I think you hit the nail on the head there. The only thing I want to add to that is just maybe a couple other exercises that I like to do. You mentioned Romanian deadlift, which is a movement at the hips that we would also classify as a hip hinge. So you're hinging the hips backwards and you're isolating those hamstrings. Sometimes I'll take a double leg RDL and turn it into a single leg. And that's just going to cause that involved limb to just be much more, challenged in terms of the stability and the balance on that leg. And then some other ones that I like to do, like I'll even do like a Peterson or like a step down squat from a box or something with that leg, and just make that eccentric as well. Or lastly, what I'll do is, well, not lastly, but just kind of the big ones that come to my head is, I'll do like a leg press, but I'll put the feet high up on the leg press. So you're getting less of that quadricep activation and it's getting more into the hamstrings and the glutes. And so I like to do those. So like leg press with the feet high. I'll like to do like a Peterson step down squat, or again, like turn a double leg RDL into a single leg RDL.
Yeah, totally. Even like tweaking their squat form. So maybe instead of doing a normal squat where your knees go pretty far forward, you do more of a hinge squat or a sumo squat, which gets your torso tipping over a lot more. You're sitting your butt back, and that just tensions the hamstrings more because maybe they can't quite handle the stretch that you get in a single leg RDL or a double leg RDL, but they could do a squat, and over time you scale up to those higher stretch movements.
Yeah, yeah. Oh, and then also, sorry, another one too that I just thought about, because I think it's good to bring this up. If you have like a higher hamstring strain, so like that hamstring strain is more up by the hip, I'll also do like just like a hip extension, right? Just because it's probably more of those fibers of that hamstring. If it's up kind of on that sit bone, it's probably more of those fibers that are going to help with the hip extension as well as knee flexion. So I'll also throw like hip extension if it's more of a higher hamstring strain.
Yeah, and that just goes off of the hamstrings being a 2-joint muscle where they cross the hip and the knee. And so if you have an injury of more of the butt portion, you want to bend more at your hip. If you have an injury more at the knee portion, you want to bend more at the knee. Going off of what you said, if you have a hamstring issue more in like the middle of the muscle or kind of lower down, closer to the knee, you might choose exercises that bias more of knee movement. For example, like a seated hamstring curl is going to really get that muscle belly burning quite a bit. Or if it's more closer to the knee, you might do Nordic hamstring curls where you really, really tension behind the knee and less so at the hip itself.
So, and then I think I kind of like how we're making our way through the CPG right now. We started with, what are the hamstrings, and then what are the risk factors, examination, diagnosis, and now we're getting into the treatment part of it. I want to just dive a little bit deeper and kind of think of like, all right, we have a patient or an athlete who's getting towards the end of their hamstring rehab process, and one of the things that they talk about when returning from a hamstring injury to try and help prevent hamstring strains in the future is progressive agility work and trunk stabilization. So, Christian, what does it look like for you? Let's say you have a sprinter or some type of like, maybe like a football player, soccer player that's ready to return from a hamstring strain injury, and you're kind of ramping up their activities back up again, what are some of the things that you look for or you like to do in terms of like progressive agility training?
So this really brings about the topic of specificity, which is like a big word used in strength and conditioning, but also very pertinent to rehabilitation, where the fundamental idea is that people only get good at the things you do. And that's because your body doesn't want to waste resources getting you stronger or more resilient in ways that it doesn't need to. It takes energy, and energy is precious, at least evolutionarily.
And it's that whole specificity piece for me. It just means that it's going to look different person to person. There's not one progressive agility program or, return to sport program, even within the same sport, that's going to probably be exactly the same from one to the next. It's going to depend on person to person, right? One thing I like to talk about is, for example, like in football, like if I'm rehabbing an offensive lineman versus rehabbing like a wide receiver, right? Their return to sport progression, especially when it comes to like agility training and whatnot, it's going to look extremely different, right? An offensive lineman has to be able to withstand their ground and hold against a lot of weight, right? Versus like a wide receiver. Yeah, you bet we're going to get out there and do a lot of cone drills, a lot of cutting, a lot of sprinting, jumping, etc., because that's what the demands are for that position. So yeah, it's definitely specific, and it's definitely going to look different person to person, especially sports. With returning to sport from really any injury, it doesn't have to just be hamstrings, right? We're going to get you to a point of where you're able to, get those basic foundational movements down and be comfortable and, pain free, etc. But then it's going to look different when you get back to, with your coach and whatnot, where you're going to really be able to start pushing yourself again. So, I think it's again just bringing up the point of everyone is going to have their own specific timeline, their own specific set of drills that they're doing, their own specific set of exercises, etc. So not one thing's going to look the same as the other. And that's going to go for basically any body part, any type of injury. If it's a strain like this, or if it's a post-op, like a post-op ACL or whatever it is, those time frames and how people get back are going to look a little bit different.
And I also like the point where they said it really is helpful to keep doing that trunk stabilization stuff. I wasn't aware of that research. That's a newer thing for me. But I mean, it makes sense. If you want to get some additional gains in your plan, you should just be able to move pretty well. So like be strong all over, be coordinated all over. I would say I don't tend to use the word stability or stabilization because it means a lot of different things to different people. So I like to use the word control. Like, are you in control of your body most of the time? If so, you're probably doing pretty well.
I would agree. I think that if you come in and you have a pretty irritable hamstring, I think it's great that the CPG talked about the trunk stabilization, because along with you, I didn't really, I guess, think a whole lot of that, but I totally agree. And yeah, if you have a really irritable hamstring, and then you can do trunk core stuff, or, you could do more lower in the leg exercises or more upper body exercises. Like you can do a lot of things that are still going to really help you out in the future while you're trying to get this hamstring to calm down. And so it's nice that the research shows that, because it gives us that extra tool in our tool belt to be able to do things early on.
Yep. Yeah. So I guess just to recap on that rehab plan for the strengthening piece, it's going to look very different for every different case, but generally you're going to start with whatever hamstring exercises that person can handle without pain, or like going right up to the edge but not really pushing through it. So day one, that might start with you just lying on your back, bending your knee back and forth, progressing eventually to standing up, bending your knee, maybe doing some double leg bridges, then some single leg bridges, maybe adding in some squats. A couple weeks later, maybe you're doing some RDLs or some single leg RDLs. You just keep scaling those movements up to harder difficulties, adding more weight, emphasizing that eccentric, and doing them pretty often. I don't think we mentioned how often you should be doing these things, but
Yeah.
the CPG mentioned two to three times a week. And that's what I tell everyone as well. I'm like, you don't need to be doing long term at least, these exercises 7 days a week. 2 to 3, that's going to give you some pretty robust gains.
I really liked how we covered it from kind of beginning to end of getting people back into rehab. I think the CPG, really all CPGs, but this one in particular does a great job of kind of laying that out in almost a manner of like someone comes into the clinic, first day, this is what it's like, all the way to discharging them and trying to prevent further injury in that hamstring. Anything else with the hamstring rehab or hamstring CPG, Christian, that you'd want to touch on? Or do you feel like we've just done a great job summing everything up?
Well, there's always more that we can do, but I do think there's 2 things that we should touch on. One is going to be injury prevention.
Yeah.
So how do
Yep.
you do your very best to prevent these injuries from happening? And the one theme that you'll see in individual research papers plus the CPG is that doing the Nordic hamstring curl exercise seems to help quite a bit. And I don't know if it's just the magic of that exercise itself, or it's just because it's very hard to do and it requires a lot of requisite strength to be able to do it. And so if you can do a Nordic hamstring curl, you can probably safely bet that person's fairly strong in their hamstrings, at least relative to their body weight. And perhaps that itself is what leads to that injury prevention. I don't really know. I just know that if you look at the research on it, it's a damn good exercise. So I think the number they had was, if you can successfully train Nordic hamstrings for several weeks to months, you will likely see about a 50% reduced injury risk. That's pretty substantial for just calling out a single exercise. The only problem with that I have is, like I said earlier, they're really, really hard to do. It's kind of like a pull-up. Not everyone can just jump into a Nordic hamstring curl. So what you have to do is you may have to build up to that very slowly over time by starting with those other hamstring exercises we mentioned, and maybe even going on to assisted Nordic hamstring curls where you use your hands to help you, or you have a partner help lower you down, and eventually you work your way up to the real Nordic.
I don't know if it's something about with the exercise or if it's just really, really hard. I'm going to lean on the fact that it's just really hard and difficult to do. And it's a heck of a way to strengthen those hamstrings. I think another thing for me, and this kind of goes again across a lot of other body areas and body regions, injuries and injury prevention, but I would encourage, especially for individuals who might be in like their teenage years, to be playing multiple different activities, multiple different sports. If you're a track star and you sprint, 10 months out of the year, 11 months out, and like that's all you do is just sprint. Well, that's a lot of stress that you're putting on that hamstring and quite frankly other parts of the leg. Not saying that that's bad to do, but I'm just saying that if we can get variability in your activity and your sport, and then to me, I would argue that's setting you up for lower risk of a hamstring injury because you're not just putting the same, back to Greg Lehman, right? You're not putting the same water in the same cup over and over again until it overflows and we start to get an injury. So tissue tolerance, I think it can be helped if we have variability in sport and activity in which we do. And then, throw in Nordic hamstring curls every week until you can do a lot of them. I think that those two are a good way to try and help prevent something like a hamstring strain.
100%, totally agree. And the last thing that I'll say about injury prevention that they mentioned was just generally being fit. Like if you do a comprehensive, well-rounded strength plan, you've got some agility in there depending on your sport, you've got some trunk work, you're working on your control of your body, you do that kind of approach, that itself is going to be reducing your risk of an injury.
Yeah, I think just a funny story to bring up. Well, it's more of an example, but if I had $1 for every time, a middle to older aged male told me about how their beer league softball career was ended because they had a hamstring strain rounding first base. Excuse me. That kind of goes to your point about just being generally fit, right? If you're mixing beer and sport, there's probably a good chance you might pull a hammy rounding first or second base.
Yeah, so that's a very Midwest thing to have. Over here
Yeah.
with us coastal elites, it's pickleball.
There you
Everyone,
go.
New
Yeah. Yeah.
Jersey,
Yeah.
New York, Boston, they're all moving here and they're all retirees.
Yeah.
And even the Mainers, like they're all playing
Yeah.
pickleball. They're playing
Oh
pickleball like
man.
7 days a week, sometimes twice a day. They're in leagues. It's nuts how much these people are playing. And so what I've noticed over the last few years is a lot of hamstring strains. It's just, and a lot of Achilles. It's just those two, they're
Yeah.
happening
Yep.
so much now.
Right.
Well, the last thing I wanted to bring up, Eric, was going to be how strong do you have to be? Do we have good
Mm.
guidelines to tell you for like you need to be this strong to reduce your injury risk by this much?
Yeah.
Like I said earlier, it's like not super clear, but we do have a couple numbers that popped up in the CPG. So a major concept that we use is going to be limb symmetry index. That's where you just compare like the strength of your quad, the strength of your hamstring from side to side. So you compare the injured side to the non-injured side. The CPG said that if you're at an 80% limb symmetry, so your injured quad is 80% as strong as your non-injured quad, or sorry, hamstring, you're at a 3.4 times greater injury risk. If you're at
Mm.
85%, it's 2.4. So like there's a pretty big jump between 80 and 85. I don't know if that jump keeps going if you go 90, 95, 100%, but like generally the stronger you can get it, the more likely you are to be better off.
That's what I was going to say as well. Basically, just recapping what you said at the end there is the stronger that you can have the hamstrings, then the more, I'm just going to go back to this cup analogy. The stronger a muscle is, or stronger a tendon is, or whatever tissue it is, likely it's going to be able to tolerate and handle more stress, and it's going to have more, a bigger cup, so to speak, to be able to load or accept more stress to it versus a weaker muscle or a weaker tendon or whatever that tissue might be. So I would agree that it's kind of hard to get specific quantifiable numbers into it, but kind of what you alluded to with the limb symmetry. If I do look at hamstring strength in this, I usually look at limb versus like, I might do like dynamometer testing with the hamstrings, and then the patient will ask like, oh, like what's the number I want to be at? And I normally say, well, I'm looking more from side to side versus just a single limb, just because I don't think we have enough research out there yet to be like, oh, you need to be producing 66 newtons of force with your hamstring to show normalized value. It's more of a side to side thing. And maybe, I don't know, maybe I'm behind on that. Maybe there's research out on that right now that could be read up on. But for me, like I said, it's more of a, hey, the stronger that tissue is, the more stress it can tolerate and likely lesser chance of getting a hamstring strain.
Yeah, totally. I think I don't know the numbers on this for sure, but I think the way they're trying to move in the research is trying to figure out how much force you exert per your body weight
Mm,
and trying to get good numbers on that by sex and by sport and by age. And so like that's probably the best we're going to be able to do for finding a strength standard. There's some decent research on those kinds of numbers in ACL injury, but I don't know about hamstring strains.
yep,
Maybe.
yep. I love how we talk about research as like there's just like a group of people somewhere out in the ether that's doing this research, and we're just kind of we're just chilling, we're just waiting for them to tell us what to do.
Dude, we're the normies. Like we're just like two
Yeah,
dudes treating people
yeah,
every single day. They're out there in like the big universities. They got their PhDs. Like, yeah,
yeah.
I don't want to do that work. I want to treat
No,
people. That's more fun for me. So I do trust their.
right. They put the Superman cape on every day and go get the research for us, and we just regurgitate it.
Well, and what's really cool about physical therapy research is people are super chill about. They're like, look, we don't know for sure. This stuff is really hard to measure.
Yeah.
It's not like trying to do like calculate the exact math for whatever it takes to build a bridge. It's just like these are real people with so many infinite variables. You just can't figure it all out. So you do the very best you can. You hope for the best. You exert
Hmm.
the best possible plans with the right people over a long period of time, and that's really it.
So I think, I mean, for me, man, I think we covered quite a bit of the hamstring, and I think utilizing the CPG to lay out plans and what we should be doing. I think a lot of good information came out of that. I think the biggest take home message for me is just variability in what you do and try and keep that hamstring strong. That's really the name of the game, as simple as it can be. And so as long as you're participating in a good, well-rounded strength and conditioning program, and if you're listening to this, maybe start throwing in some Nordic hamstring curls to really strengthen those hamstrings. But I mean, outside of that, if you do get an injury or whatever it is, definitely work alongside a rehab professional like a physical therapist who can help guide that process and then hand you off to people like your sport coach, strength and conditioning coach, etc. All right. Well, till next time, Christian. Thanks for giving us this idea of the hamstring CPG. It was a good one.
Yep.
All right. Well, you take care. Thanks everyone for listening, and we'll be back next week with something.